Ability to have students connect with our patients.
Reaching out to the colleges and teaching our providers of our future the soft details that they're going to need when they become physicians.
How important patient care is. Because when I thought of medicine before, I just thought science, treating people, but there's really this human connection that is made that I kind of learned through PCAT.
The PCAT program is a unique experience that allows students at Cornell to volunteer in a hospital and really be able to get a first-hand look into a possible field or career that they're interested in. I've watched this experience be really transformational. I realized that they needed to become humble and learn about each room that they were going into in terms of that person's experience, their narrative, and their story.
I started this program with two questions in mind. What does it mean to provide quality patient care? And also, what does it mean to be a leader? Back at Cornell, I was able to reflect on these experiences during the bi-weekly leadership seminars. I created my personal identity map and learned how to use it as an asset.
What I was so impressed with the videos was how much the students took away the importance of compassion with our patients and how we as providers need to learn from that.
What we thought they were going to learn is, you will learn how to be nice to people and be able to knock on doors and come in and speak to them. But they grew as individuals.
I started in the summer and it was a really great experience. Honestly, in the beginning, it was like a resume builder, but as I became more and more invested in the program, I really began to appreciate how much the program really opened up my eyes to the Ithaca community.
Verified that I really want to go into healthcare management, and it showed me problems that are in our healthcare system, but also a lot of positive.
The leadership seminars really helped me think about it before I volunteered.
One of the things we did was identity, and I would have never thought about that before, about how patients identified or how I identified or how that would even influence my interaction with the patients.
To see them understand that medicine and becoming a doctor is more than a career, a salary, but it's actually about human connections and realizing what healing looks like and feels like and what quality care is.
The seminars really kind of helped my volunteering become more meaningful because it made me look at different aspects of the relationship with the patients and not just, here's a task to complete.
It used to be when I pictured being a doctor, I was always fascinated by the medicine and the biology of it all, and I didn't know I would really like the patient care interaction as much as I did.
Lastly, I would say the PCAT program allows Cornell students the opportunity to get off campus and to really get in touch with the people and the different demographics that live in Tompkins County. I've talked to students who didn't realize we had a Burmese population, a Laotian population, or that there was a huge wealth gap in terms of the people that they saw in the emergency room.
Before, I was really interested in international medicine and practicing abroad, but after going through PCAT, I became more interested and aware of the many problems that exist domestically as well. There are regions of our own community domestically where there are a lot of healthcare disparities and issues, especially working in the emergency room. You get to see so many different people from different socioeconomic statuses who have lack of access to healthcare.
I always had this aspiration to become a doctor. When I was young, I wasn't sure whether I still want to go pre-med or not. So I thought there was an opportunity to try, and seeing that there are leadership seminars every single week, it became something I should commit to, and it came out that it's something that I want to do.